dear esteemed colleagues, it's a big honor to be here on this wonderful sunny afternoon in Antwerp, and it's a pleasure for me to address you. I want to thank you, of course, the Belgium EU presidency for organizing this very interesting event in a whole series of fascinating events on health in the context of the EU presidency of Belgium. It's a real privilege to be here. And obviously, I'm honored to speak about some of the lessons learned from past epidemics and pandemics and preparing for the next ones. Now, you see whether I can operate this slide here. Yes. So yeah, that's quite a theme. Actually, one could say that in a way it's easy to talk about it, but it's also very difficult to talk about it at the same time. It's easy because pandemics have killed millions of people over the last decades and centuries, and actually we got a very nice run through some of the major pandemics this morning by Irene Nordstedt. And each outbreak obviously has augmented our knowledge about epidemic control. But at the same time, it's very challenging and it's difficult to talk about that because each epidemic is different and inherently unpredictable. And the covers that you see here on the slide actually illustrate this dilemma, taking us back to the early 2000s, where we were concerned with avian flu, with a focus on Asia and transmission by birds. Then in 2009, we got surprised by the swine flu, which occurred in pigs in Mexico. And now the recent weeks, we've all followed, I think, very closely the developments in the US, where H5N1 has been detected in large amounts in cow herds. Finally, COVID-19 stood out, obviously, as a stark reminder that despite the long-standing history of epidemics, our societies and health systems remain ill-prepared and precariously vulnerable. As we are wondering how to prepare for the next pandemic, in a global perspective, there are three overarching takeaways that we can build on. First, global emergencies require a global response that is based on universal characteristics of pandemics and successful responses over the past decades and centuries. Second, while the exact nature of the next pandemic is unpredictable, a wealth of knowledge has accrued about what we can do here and now to better prepare. And it is our collective responsibility to translate this knowledge into action. And third, we need to acknowledge our ignorance about the next pandemic and turn to science and research to help us understand and save lives. What patterns are emerging? What can we do now to prepare? And how can science help us confront the unknown? These are the three questions I want to touch on in the next 15 minutes. Now let me start by addressing some of the universal lessons we've learned over time and which were confirmed in the COVID-19 pandemic. Obviously, as you're all well aware, there has been a multitude of reviews on COVID-19. And of those many reviews and lessons learned exercises, I just want to single out two. First, and you see both here are represented on the slide. First, there's a WHO-led review of lessons learned that is interesting because it didn't just build on COVID-19, but largely was based on the experience of more than 20 years of outbreak control by the GORN. You all know the Global Outbreak Alert and Response Network. So this review resulted in the development of a framework on strengthening health emergency prevention, preparedness, response, and resilience. In short, there's an acronym, HEPA, a new acronym on the block that we need to get familiar with, and that has gotten a lot of traction actually already in the last 2 years. The second review was published by a WHO European Regional Office commission called the Pan-European Commission on Health and Development, which was chaired by ex-Prime Minister and ex-EU Commissioner, Professor Mario Monti. Now, this commission was particularly interesting because it was composed largely by non-health experts and looked at pandemics in the broader context of social and economic development. Based on these reviews, let me mention 5 characteristics of pandemics and responses that may have universal importance for future preparedness. First, as I've said, new epidemics are per definition unpredictable. However, there's one thing that we have consistently seen in epidemics, which is that epidemics don't affect populations uniformly. Each epidemic targets certain groups more than others. So now we all vividly remember, obviously, the picture of COVID-19, which predominantly affected older people, with an estimated 95% of all mortality occurring in people above 60 years of age, and that persons with certain preconditions, such as non-communicable diseases, were at particular risk. This slide here shows another example, with 2 types of bird flus affecting, despite similar transmission patterns, very different age groups, the older and the younger, differently. Now, understanding population vulnerabilities is not only key for a successful response to an epidemic, but reducing vulnerabilities prior to a pandemic is a key preparedness measure. Epidemics extract the most visible toll on those who are infected and sick. They are the ones who are usually reported by government and also in the media. What is less recognized, though, are the casualties from disrupted routine health services. The undetected cancers, the untreated strokes and heart attacks, the unvaccinated children, the TB diagnostic rate, detection rate that goes down. On this slide, you see a comparison of the estimated reported direct mortality due to COVID-19 in Europe in 2020 and the total estimated excess mortality in the same period. And you can see that for every COVID-19 reported death, we've seen 1 additional death beyond the normal. Now, much of this may be explained by underreporting, but not all. This underscores why a dual-track approach, namely the importance of building service continuity into pandemic preparedness, has emerged as a second key lesson. Much like a virus, false information spreads rapidly and exponentially, again, as we've all witnessed. False information can cause disease, distrust, and division in our society, and even death. This is our third lesson. The COVID-19 pandemic has shown this clearly. For example, a study that you see here represented estimated that some 17,000 people may have died after using hydroxychloroquine that was wrongly promoted as a COVID-19 cure, as you will recall. Health emergencies throughout history have been accompanied by infodemics that make it hard for people to find reliable guidance and take appropriate action to protect their health. To combat this, WHO has developed the concept of infodemic management to prepare for, address, and mitigate the dangers of false information in health emergencies. All epidemics I referred to so far had their origin in animal populations. Zoonotic infections in humans are not a new phenomenon, but there has been a marked increase due to various reasons that include globalization, urbanization, deforestation, and climate change, which are changing the way that humans and animals live and interact with each other. Take, for example, the concerning example that I mentioned of the H5N1 outbreak in the US cow population that we've all followed closely in the past weeks, as you can see on this slide. So lesson 4 is that we need to consider today more than ever animal and human health as one epidemic space, and accordingly plan and act in one concerted way using the One Health approach. WHO hence calls for a One Health approach, which will also be a key element of the pandemic accord currently under negotiation. The final and fifth point relates to coordination and governance. While during COVID-19 all countries were working off the same albeit evolving evidence, each country translated the evidence into a different set of social and public health measures. So the slide here that you can see, and I admit it's difficult to see, but what you will see is a very colorful pattern there. Every line seems to be different from the other. And this slide is actually an extract from our database where we are monitoring, and we were monitoring the public health measures put in place by each country, in this case here in the European Union. So what we see here is that each line seems to be different from the other, signaling that each country had a different set of measures in place or to a different level of intensity. These differences were shaped by factors such as differing interpretation, insufficient information sharing, competing authorities, and political considerations. Coordination and improved governance may hence be the most important factor in determining the success of or the failure to future emerging epidemics. The improvement stands at the center of ongoing efforts to strengthen institutions, including in the EU, to negotiate the pandemic accord and to strengthen international health regulations. Each of the 5 mentioned universal characteristics of pandemics and successful responses have taught us valuable lessons that we can apply here and now to collectively future-proof our emergency responses. Last year, at the annual meeting of WHO's member states in Europe, in the European region, these 53 member states have asked us to pull together an overview of the actions that do precisely this, namely prevent, prepare, respond, and increase resilience for future emergencies. This overview will go to the next regional committee that will take place in October of this year in form of an action plan for the next 5 years for the European region. We call this action plan in shorthand Preparedness 2.0 because it builds on the very lessons I've outlined above. Preparedness 2.0 has 5 action areas that you can see depicted here on the slide. And these are based on the Global Emergency Framework, the HEPA, which I mentioned before. Now, I would like to just highlight a few points for each of them. The first area is called collaborative surveillance. The notion collaborative describes well the key improvements we are seeking, which are bringing together data from human, animal, and environmental sectors, enlarging our data sets to also capture vulnerability factors such as NCDs, disease spread, and the impact of measures taken, and most importantly, ensuring that the data reaches those who ultimately make public health decisions. We've seen some good examples already, especially here in the European region. For instance, the launch of ERVIS, another acronym which stands for the European Respiratory Virus Surveillance Summary, that brings together in a coordinated way COVID, RSV, and flu reporting. The second area, community protection, signifies the ultimate goal of all emergency efforts, communities collaborating closely with health authorities. True protection is achieved when communities are actively engaged and interventions are collaboratively designed and implemented to address unique risks and requirements. Take, for example, the 22 Mpox outbreak, where community engagement and risk communication were indeed instrumental for controlling its spread in the European region. So Preparedness 2.0, WHO is calling member states to establish equitable, community-centered emergency health systems, rooted in trust and marked by shared accountability. Access to countermeasures is the third area I want to talk about. One of the very welcome developments here in the EU is the formation and the launch of HERA as a new institution to look into health emergency preparedness and response. HERA was launched in response to the dilemmas that countries have experienced in understanding what countermeasures to apply, and once developed, ensure full and equitable access. And we've all seen in the COVID-19 pandemic that access to countermeasures, including protective equipment, diagnostics, vaccinations, was woefully inequitable within Europe, within the world, and sometimes within countries. In the language of the draft accord, the importance of benefit sharing has taken center stage actually in the discussion, including intellectual property rights and the financing linked to that. And equally important, however, is the first mile, fostering research and development capacities to fast-track innovative countermeasures and systems to assess them and to deploy them effectively. I've mentioned previously the term dual-track approach when referring to the need to care for those affected by the epidemic while also ensuring that routine healthcare services continue and avoid a high toll of indirect deaths linked to any epidemic. So scalability and resilience of healthcare services are critical to adapt and to function under extraordinary conditions. Preparedness 2.0 proposes multiple actions to ensure safe and scalable care, including essential care packages, infrastructure, the workforce, and supporting norms and regulations. Key to our emergency response is also the deployment of emergency medical teams, so-called EMTs, like the one that we have here in Belgium, the so-called BFAST, which is playing an extraordinary role in responding to multiple emergencies across the European region. And you can see here a photo on the slide behind me. To support these efforts, WHO is establishing a regional European EMT competence hub in Istanbul. Emergency coordination, finally, is an important area. Improving emergency coordination is crucial for managing future epidemics. At WHO, we promote an all hazards, all sector approach that brings together all the different pieces of the puzzle: the legal and ethical frameworks, the coordination mechanisms, the funding, information sharing, and capacity elements. The best examples of such coordination are the so-called National Action Plans for Health Security, or NAPS, which have been adopted and developed already in 14 countries since 2022, in collaboration and aligned with the EU and its health legislation. WHO is also focusing on improving coordination across the whole region. We are especially proud that we recently launched a pan-European network for disease control, bringing together public health agencies from across the European region. And you'll see here on the slide the picture from the inaugural event. As an information sharing and coordination platform includes not only EC, the ECDC, HERA, and other EU agencies, but also non-EU countries and organizations. A lot can be said about coordination, obviously, and particularly the ongoing negotiations, but I note that we've got Professor Kazaczki with us, who will speak to us in a special keynote this afternoon. The agenda of what we can do is huge, but so is also the famous window of opportunity that we have as long as COVID-19 pandemics are still fresh in our minds. But doing what we know that works is only one part of the preparedness. We also need to acknowledge what we do not know and prepare for the unknown through a research-focused approach. The timeline for the development of the COVID vaccine that you see here depicted was undoubtedly one of the largest successes in biomedical research in recent public health. And you can see some of the milestones here on this slide. However, the vaccine was obviously not developed in a vacuum, but it was a consequence of investing in research and technology over a long period of time. Going forward, we must continue to strategically enhance our preparedness by fostering a research ecosystem and capacities, from development to trials to regulatory approvals, and lay the ground for similarly quick developments in response to a future unknown pathogen, including by initiatives such as the Horizon Europe that was mentioned earlier. Such research should not be limited to vaccines, but also to antivirals and antibiotics, and our focus must broaden to include medical countermeasures at large, like diagnostics, point-of-care tests, innovative technologies, as well as research into non-pharmaceutical interventions. Talking about non-pharmaceutical interventions to effectively tackle epidemics, it is indeed crucial to extend our focus beyond biomedical aspects and to integrate comprehensive research strategies. These need to include conducting risk assessments by utilizing advanced tools like big data and AI to conduct in-depth analysis on vector distribution and population vulnerabilities that will help us anticipate virus outbreaks, scenarios, quantify the risks, and design control strategies. WHO's developed unity protocols can help guide during outbreaks the rapid assessment of disease transmission, clinical impacts, and countermeasure effectiveness. Going beyond the immediate, we also need to harness the power of research for looking into the future through forecasting, as highlighted in COVID-19. We now have a new collaborating center in the UK, and of course, there are many other world-class modelers, such as in the Hasselt University in Belgium, to ensure we can better anticipate future needs. The agenda is vast. The research agenda in front of us is vast. And as there are as many actors to act on this. Now, setting research priorities in this context is indeed an enormous challenge. And I would like to leave you with a reference to priority setting. As many of you may be aware, WHO is facilitating a process for the development of a so-called R&D blueprint for biomedical research. The R&D blueprint is a compilation of priorities to better prepare for epidemics through research and development, before and during epidemics, to save lives and avert large-scale crises. As you can see on this slide, currently 10 pathogens have been identified, including disease X as a placeholder for an unknown future pathogen of pandemic potential, each of them with detailed outlines and recommendations. Now let me conclude by recalling the moment of hope that we celebrated collectively at the development of the first COVID-19 vaccine at the end of 2020. It is up to us to sustain the momentum of such moments until we have truly made the world a safer place. Past pandemics have left a legacy of lessons. Now, turning these lessons into lessons learned depends on whether we will be able to collectively implement the actions that we know prepare us for a better future and for the uncertainties of future events. The new pandemic accord that we still hope will go to the World Health Assembly at the end of this month will be a litmus test of our ability to act. The accord is not just an opportunity, it is a necessity. It embodies our collective commitment to move from reaction to prevention, and it strives to ensure that communities, countries, and the world are protected from the threat posed by pandemics. With the lessons learned from COVID-19 driving us, we hope to see a future where global collaboration, continuous innovation, and equitable health strategies are not just ideas, but realities. Thank you.